I find it's helpful for us to remind ourselves of why do we care about reproducibility? And the short answer is it's because there are many things we're trying to do with biology that we today cannot. Whether that's in areas like health, where we're entering a world of generative medicines. This is Layla Richards, who in 2015 over in the UK was one of the first successful recipients of CAR-T immunotherapy to help cure her diseases, which in this case was cancer. And this world where we have complex processes that integrate computer science, software, bioprocessing, manufacturing, and patient information and insight all together to produce unique compositions of matter per patient. Or of course, how are we going to produce the biomass that we need to drive these industrial processes? Or the food for a growing population on this planet? When we face challenges like the fact that, the wheat genome is an order of magnitude larger than the complexity of something like the human genome. We need tools that enable us to work with biology at this scale. Or of course, in industrial biotechnology, where we have to talk about how we make thousands of novel compounds, both to create new materials and also, of course, to replace our existing manufacturing processes based on process chemistry, enabling a more renewable world. In all of these applications of biotechnology today, though, they're highly complex, these engineering challenges, and they're error-prone. They take too long, and as a result of those, they cost too much, fail too often, and at its core, cannot be built atop in ways that we do in other engineering disciplines. Now, if we can make this merely complicated, we know how to scale it, how to work with it. This is the BASF Verbund facility over in Germany. 32,000 employees working around the clock in an intricate choreographed dance, driving process chemistry reactions that we know how to take down and understand as unit operations. We know how they interact, and thus can build composable models that enable us to scale to the megaton production with this type of operation. And in fact, it's taking these complex operations and making them merely complicated that's been the heart of every industrial revolution up to now. Now, when it comes to complex, though, biology is the poster child for it. It's filled with the unknown unknowns, with the complex high-order interactions between the component parts. It means that we can't just, look at a wolf and a sheep in independence and then understand what happens when you put the two together. And of course, if you continue to try to look at a complex system, like in this case, a biomanufacturing process, and you look at the wrong parts of the system, you don't look at the emergent complexity that sits between all the interacting factors within it, well, you don't gain insight into what's happening. It's like trying to cook a recipe for a cake and not including the temperature, which leads to a highly variable outcome. It's only if you can pull back and look at the full complexity of these biological systems, build models atop how the different factors, the different parts interact, that we start to gain actual insight into what's going on in these complex systems, which is something that can only be accomplished both by better software tools enabling us to design these complicated experiments in the first place, and connected automation to give us the experimental capacity in the physical world to actually collect the correct insight that lets us build models atop these complex systems. With, of course, the real-world pragmatic outcomes that means that you can do things like drive an order of magnitude improvement in the yield of a biotherapeutic in the course of weeks rather than years. And if we don't work that way, well, that's how you get a negative exponential to describe the productivity of an entire industry, pharma, where for every 18 months for the last 65 years, it's doubled in cost to bring a product to market. There's no other industry on the planet with a negative exponential that describes how effectively we work. Now, of course, how do we flip that around? Well, one of the most useful things is to learn from analogy by other industries which have accomplished exponential productivity increases per person in that field. The classic example of that, of course, is Moore's Law in the semiconductor industry. Now, to be clear, it's an entire stair-step of transitions that has enabled us to have this increase that today means billions of transistors can be designed in a single chip by a single designer. But the single most important inflection point was the early 1980s and the introduction of high-level design languages, Verilog and VHDL, which all of a sudden meant that you could transition from an artisanal discipline where, we would do the equivalent of assembler to think through every single low-level detail of what it takes to accomplish a task, to now having a high-level interface to the challenge, similar to what has happened in programming languages in IT. And it means that you could then transition from having to do everything in your experiment by hand, where we taped out a chip by literally putting pieces of tape on glass, not at all unlike a lot of the experiments I've seen in labs, to a modern industry where you have an integrated combination of many different manufacturers and participants. Antha is a high-level language enabling exactly that in transition in wet labs. It enables you to say what it is you're trying to do in a wet lab, and through our distributed operating system, it means that you have a connection between the experimental design that you're trying to accomplish and all of the hardware it takes in the real world to actually implement these incredibly complicated processes. And this is enabling order of magnitude transitions in how you can produce and design experiments. Waiting for this to load. It means that in minutes in your web browser, you're able to describe a complex process, such as an example, a standard synthetic biology pipeline, which just as easily can be things like a gene therapy production process or a CAR T-cell modification cycle. And by dragging and dropping these reusable, translatable, experimental working practices, what we call elements, you can rapidly iterate to an entire experimental design for your end-to-end physical process, where you're now looking at the parameters of your process as the area of your design innovation, as opposed to just the logistical challenges associated with actually running these physical processes. It also means that you've got a complete end-to-end provenance chain. All the data points are flowing out for free in an integrated format, because we flipped the experiment around. Instead of doing an experiment and then writing it in a piece of paper, you've described what will happen, and the software takes care of the execution in the physical world. And it means that you are not sitting there thinking about how do I optimize a plate, or take advantage of the multi-channel capacities of my liquid handler, or translate it from one platform to another. You're focusing on what matters, the biology. And it also means that implicitly we're tracing the reliability and reproducibility of the underlying elements, because you can apply the same sort of multidimensional investigation and machine learning to the unit operations that make up our wet lab operations in the first place, taking them from working, say, a third of the time, because half the time our cell lines don't transform, the other time it misassembles, to something that reliably produces a cell line 100% of the time, and 99% of them are the correct construct, enabling you to, for instance, investigate all of the genetic interventions of thousands of designed cell lines. And that works on hardware from many different manufacturers, because you have abstracted away from low-level details like how do you actually drive that liquid handling platform. That's why today, Antha is already driving orders of magnitude improvements in productivity in major multinationals. And this is across every sector from life sciences to industrial biotechnology to ag science. And of course, next generation applications like data storage and DNA with customers like Microsoft. We see that Antha is the change in how it is that we work that's going to be mandatory for us to professionalize as an entire sector. And it's the way that we can begin to talk about properly engaging with the true power of biology. Thank you.
Hi. Once again, how extensible is this language, and how can I get a hold of it?
Sure. It's extremely extensible in that it's open source up on GitHub for the core language. Additionally, you can license our operating system, which includes, in many cases, proprietary drivers to talk to the various pieces of laboratory equipment in your lab. So we tend to look at it as a function of, which hardware you're trying to connect into the overall system.
So as a backup question, what if you didn't have a lab, and nor did you ever want one? Could you actually imagine a future where a text miner would be able to pull an actual method section and try to structure this into your language?
Absolutely, because you can in fact simulate experiments and see if logistically they can be accomplished. We can't simulate biological function yet. That would be an amazing leap. And in terms of that, we currently at Synthace don't offer a cloud lab, but then that's off the observation that my customers like Merck have $2 billion of hardware already in their place.
So if your software is open source on GitHub, what is your business model?
So the underlying language is open source on GitHub. The OS and the visual design tools that you're seeing, as well as many of the drivers that connect to different automation platforms, unfortunately that part is closed. And that's also largely off the fact that many of the manufacturers are still very proprietary about how their hardware can be talked to.
Right. Okay, thank you.
But then Linux has closed source drivers as well. It's the way the world works. Thank you. Oh.
So what does it typically cost to get a closed source? I just talked about instruments where the drivers, are basically open source.
Yeah.
What does it cost for like closed source driver if you wanted to run, a Perkin-Elmer machine or something like that?
Absolutely, and we've been working with them on the Janus platform, for instance. The answer there is it's roughly proportionate to what you would call the maintenance cost for the equipment, is the overall licensing fee for Antha. So it's very much like what you're already used to as paying for, in essence, guaranteeing the equipment is available. This isn't correct. And it's coupled into as well the sort of cloud-based development environment for experiments and data storage as well. So there's perhaps some things that you wouldn't need, and so we can discuss on that point. Thanks.
Hi, I'm Tim Gardner, the founder of Riffyn. And Riffyn is a company based in Oakland and Boston. We provide a cloud-based system called the Riffyn Scientific Development Environment, which is designed to help you design, execute, and analyze experiments for reusable, accessible data and more trustworthy results. Although I typically start with an outline of the problem of reproducibility, I'm not going to do that here because people understand that problem. I'm actually going to start with an observation that we actually already know the solution to how to solve this problem. Most of the mechanisms to solve the reproducibility problem were described in a 2005 paper by John Ioannidis, which was really the forebear of what we understand today as this reproducibility crisis. He identified a lot of the causes using a very simple meta-analysis of experimental design. And despite the fact that we understand this, and we actually have statistical and analytical methods to deal with this problem, we aren't necessarily solving it very fast. And the question is, why is it so hard for us to get our head around what we need to do to fix this problem? And I came to the conclusion myself several years ago, which led to the formation of Riffyn, that it's because we don't have a problem so much recording data, it's integrating the data into a structured form and the methodologies by which we collect that data so that we can actually analyze it and do science to understand cause and effect. So the reality today is that science looks a little bit more like this than what we imagine from in our heads. I said my name was Mark with a C. That's kind of how we communicate. And the result of that is that we spend an inordinate amount of our time wrangling data together to do analysis. We do our experiments, we get a sketch of what we want to do, and then after the fact, we structure it, we quality control it, hopefully, and then we try to put it together for analysis. It takes so long, however, to do that structuring that we often don't do the analyses. And as a result, we accumulate errors, not just analytical errors, but fundamental errors in how we executed the experiment. And those accumulate. Because we don't analyze the errors, we don't identify the causes, we don't fix them, our progress is slowed. And this is an example of what happens when you do fix the errors. This is a screening program run at a company that I used to work at where the error was reduced about 6x and the productivity of that organization doubled overnight. Not more people, not fancier robots, just reduction in error in measurement. Because what happens is that there's a lot of discoveries that are going right underneath your nose because they're typically buried in noise and you can't see that as a result of the error. So the problem with reproducibility isn't just a meta problem of all of us spending money on false results. It's a problem that you're missing discoveries you could otherwise have in your very own lab. When you have error and when you have disjointed data that you can't collect together, you tend to reduce your worldview to a single experiment. What can I learn from today's experiment or this week's experiment? But often the data and the range of perturbation in a single experiment isn't enough. When you aggregate data, because you can, if it's high quality, you can start to see relationships emerge from the aggregate of experiments that you can't see in any one experiment. You can only do that with quality. You can only do that with data that you can access. And this, in my mind, is what I talk about when I say a supply chain of methods and data. When you can start to put together data into aggregates from your lab, from your own history, from other labs, you can start to see much more powerful cause and effect relationships. So how do we build that kind of supply chain of trustworthy data, data that you can use, data that you can rely on? Well, it starts by recognizing that we're missing something. Science is based around observational concepts. So we run into the lab, we sketch out an experimental design, and we collect a lot of data hoping to see an effect. Every other field of human endeavor starts with a blueprint. And we kind of have that with science, with protocols, but it's much more than a protocol. It's about experimental design. We typically take this approach today. A protocol written in text. Biotin is unstable at high pH, so be fast but precise. How do you execute that repeatably? You can't. Even if it was better written, it's hard to distill from verbal information like this what you need to do. When we try to transfer technology, we sketch out things by hand with process diagrams. And that, too, is people reaching for something more than the typical written description of protocols. So this is what Riffyn has done, is take that concept and embed it into cloud software. So a typical experimental design or execution is illustrated here. This is an animal study where hand batch records are used to collect data about the animals, and then data is pushed into a spreadsheet. This is the transformation of that same experiment into Riffyn. Process flow, mapping the individual steps in your process, the flow of materials, equipment, reagents, supplies from step to step, and the acquisition of data on each of those entities as it flows from step to step. As you pull the data in, the system automatically integrates that and allows you to run cause and effect analysis in instant that you see here on the bottom, which is showing that the diabetic type, the gender, and the dose route and their effect on the blood concentration in the animal. We've taken all those concepts, put them together into one cloud platform that takes you from the design phase, the mapping out of experiments and processes, the tracking of data samples and measurements across those processes, the integration of data through an analytics engine, and then a collaborative sharing in real time. Since it's a cloud system, you can share all this just like you do Google Docs. And together, this solves what we see as the three critical barriers to reproducible outcomes and faster development. Visual design, unambiguous visual representation of your experiments that are shared, real-time data integration, and immediate analysis of cause and effect. All of this in Riffyn is put together into statistical data frames, which you can pull out through the APIs, and you can feed into data lakes or machine learning algorithms stacked not only across experiments, but across iterative versioning of your process. And the net result of all of that we hope is that you go from a world where you spend 80% of your time on analysis and, on data structuring and data preparation, and you instead spend 80% of your time on analysis. And I will leave it at that. Thank you for listening.
Do you find that, sorry, keep doing that. Do you find that timing the rate of experimentation, the rate at which people do things to be critical, and how do you control for that in your process?
The rate is in how many...
When someone does an experiment, how quickly they do each step. There's a protocol, but I always got worse results than my neighbor in DNA preps. I'm
going to generalize that question a bit. The typical reaction to, I've got a reproducibility problem in my experiments, is it must be the temperature or the humidity in the lab. And I will say with 99% confidence, it's not the temperature and the humidity in the lab. It's not the CO2 of your incubator. It's something else. For example, we had an experiment where the product we produced from the cells was being absorbed into the polypropylene plate, and so we were losing a fraction of it. The solution was to use a blocker and do full sampling of the well, take the entire well out and measure that, homogenize it and measure it. So it's probably not the timing if you structure your process and procedures right. You have to develop a sampling procedure that doesn't require magical instantaneous sampling. Or if it does, you better develop a device that does that for you, because humans can't do it.
So are these procedures that typical academic labs can incorporate, or is this really industrial?
Absolutely. Most of the solutions, 80% of the problems come from 20% of the causes, and most of those are simple things, like that you don't need a robot, you don't need anything fancy, you just need to identify the root cause and then fix it.
So how do you do that on an individual basis?
Iteratively. So I have an example, not time here, but basically you have to isolate which things matter, which things don't. Then you measure properties of that, and you correlate the variability in your outcome with variation in that particular step. Once you've identified that, then you can start to pick apart the things that matter and solve them, control them or replace them.
I'm actually reluctant to ask this. I'm actually reluctant to ask this question because I think it sort of it counters why we're all here in terms of how automation in the lab of the future can increase reproducibility. But I'm going to throw it out there, and I'm going to actually ask it to both you and Sean, which is when you have these very elegant systems that are kind of going to think about the experiment for you and as you said, give you the time to analyze the data. Some of us old school people think that the beginning of the end was when everybody was able to buy kits, and students, postdocs, trainees really didn't understand the essential components that are going into each experiment because they didn't really understand what was in the kit. It's the old kit argument, and I'm just wondering whether that's something either one of you have thought about.
I'll give time to, I have a very quick answer to that, which, and then I'll give time to Sean, which is one of the customers who used our platform, before they ever put a single data point into the system, they said, they drew it all up in the process designer, and they said, I never realized how complicated my process was. And they started simplifying it. So I think it's actually the opposite. You become completely aware of what you're doing for the first time, and then you start to engineer what you're doing to be better.
And actually, the heart of what we're asking is where to abstract the whole biology. Where can you reason around things as an object, properties, rather than what it is. And what we've found so far is that you can hold that at kind of the unit operations level in the lab. So something like, say, a construct assembly, you have a measurable output with quality attached with it. Did it make the DNA that you needed to or not? Or on an assay, again, you have a measurable output, like what's the signal to noise of the assay itself and its resolution range, right? And so those are places where we have found that these applications hold. And also, like Tim was mentioning, when you look at the entire end-to-end process as a union of all of these degrees of freedom from everything that makes it up, you're actually forced to acknowledge how complicated the entire thing is. And reagents are normally pretty shitty.
Sorry. Oh.
How many times do you typically have to perform and track assays before you find a problem worth fixing?
If you use good experimental design methods, you can actually find it in a single experiment. But to track it down to root causes, it usually requires 2 or 3 iterations. You almost never, not only will you almost never find root causes in one experiment, you could never, in my opinion, discover a result that you can trust in a single experiment. Because there's a certain probability that you got it wrong, that was just a false positive, and you need to develop tiered structures where you take the results and then you verify them. And same thing with finding root causes. So you can do it quickly if you use good design, but it's usually never a single experiment. All right, thanks.
My name is Zhao. I'm from University of Illinois. Dr. Dan Small kind of introduced me in his talk. realized that I'm actually one of the few, token speakers from academia, because most of the speakers are really from industry. Let me see. How can I advance? Okay. Yeah, I think largely actually, thanks to the, inspired by the development in the microelectronic industry, there is now a growing trend in developing biofoundries that can automate the design, build, test cycle for biological engineering. So today, actually, I'm going to talk about our recent effort in the development of biofoundry, but also, try to build a global biofoundry consortium, try to share, protocols and tools that developed. And so about 3 years ago, we started a synthetic biology center at the University of Illinois. We call it Biosystem Design. And I think I brought actually more than 20 faculty from various departments. But what actually ties together is really the vision to build a foundry we call the Illinois Biological Foundry for Advanced Biomanufacturing. And we try to apply this foundry to solve problems related to microbial system, plant system, and mammalian systems. And in this foundry, we try to develop those foundational tools that will enable us to do the biological engineering quickly. And so this biofoundry actually consists of more than 20 instrumentations, and we integrate them into a larger platform. And so I don't know, this is a conversion of PC to Mac problem. And we actually break those complex workflows into process modules, which will be in turn be broken into unit operations. So we can actually program those unit operations to construct complex workflows for different applications, such as protein engineering, library screening, or genome engineering, etc. Right? And then we actually use the operating system that can actually control all the 20 plus instrumentations on the platform, so that we can perform different workflows. But the operating system is kind of complex, so we also actually develop a software we call the iScheduler that interfaces with the operating system, so that a regular user can actually design the constructor or design the workflow on a computer, and then which actually in turn will control the whole system. So actually I have a video shows how actually the whole system works. I don't know whether you can move the cursor and then, oh. Oh, okay, I see. Well, it's not that long, but anyway, so I think I posted on YouTube, and many actually people watched it. Essentially, we actually integrated more than 20 instrumentations together, and there's a larger platform, and there is a robotic arm which has 6 degrees of movement and kind of replace a human researcher. That we can, the robotic arm can, can move the 96 well plate or 384 well plates from one instrumentation to another. But anyway, because of time, I probably skip it. And so we actually try to find a few applications for the iBioFAB. So one application we have developed is really for protein engineering. So in this case, we try to synthesize talents at a low cost. And talent, of course, just like CRISPR, has been widely used for genome editing. So we developed a workflow that can actually synthesize talents in a day. And in order to do that, of course, we have to optimize all the steps, including the construction of the talents, as well as DNA transformation and mini preps. Right? But particularly, we have to optimize the assembly step so that we can avoid the picking of a single colonies. And also, we collaborate with the ADM actually to help them to construct a library of pathways that are involved in the synthesis of a particular amino acid. And we can actually construct more than 1,000 pathways just in a matter of a few days. And more recently, we actually automated the entire workflow for the engineering of yeast, Saccharomyces cerevisiae. So we actually used this automated workflow to improve the tolerance of Saccharomyces cerevisiae towards acetic acid by using a genome scale engineering tool based on the RNA interference mechanism. And more recently, clearly, we actually clearly this is not a one single lab's effort. So recently, actually, we were very fortunate to obtain a bigger grant from DOE, which will focus on the development of the biofoundry capabilities. So I assembled a core team of faculty with very diverse expertise in data mining. We have two faculty from computer science department do data mining, machine learning, as well as modeling, and so we really want to work as a team to develop the capabilities in the biofoundry. But coincidentally, at Illinois, actually a group of faculty developed a computer based on the von Neumann architecture more than 60 years ago. And it was actually one of the most powerful computer at that time. And now, actually, we have a group of faculty really kind of driven by the vision to build a biofoundry that actually will do biomanufacturing like by computing by computers. And clearly, the effort will take many years of work, right? And at Illinois, that supercomputer, evolved over the past, 50 years, and now we have one of the fastest supercomputers in the world. But I think for biofoundry, it still takes, many decades of work to eventually we can have a foundry that enables us to engineer any organism for production of any molecules. So in summary, I think what I showed is that we try to develop our foundry that can be used for biological engineering at different levels, including protein level, pathway level, and the genome level. And that's all. I think the people who did the most of the work. Thank you for attention.
Hi, thank you. That was really impressive. So, first question is, how long did it take to design that pilot program that you're running now, and how much did it cost you to implement it?
Yeah, like for the automated yeast engineering workflow, we spent more than a year actually to optimize all the steps, right, in the workflow. And also for the talent synthesis, we spent several months as well. So, but now we have those workflow ready. So for the new applications, we can just adapt them very easily. So I think now we're at a very good position to actually develop new workflows for different applications.
Okay, and the size of your team for designing those workflows?
Actually, just a few students, graduate students. Because
really?
we didn't have the funding, right? We competed for the DARPA's Huimin Foundry program, but we were one of the 6 finalists, but didn't get the funding. So then we were struggling actually in the past few years until a few months ago we had the breakthrough. Now we have the resources really to develop all the capabilities we envisioned.
Is there a special program at DOE that you applied under?
Now, this is just the Bioenergy Research Center, and it's focused on the engineering of microorganisms for production of chemicals and fuels. But in the conversion theme, I'm leading that we will devote the effort to develop the biofoundry.
Okay, and then finally, this International Global Biofoundry Consortium, will there be barriers to sharing data and process information
That's right.
across international lines?
That's right. Actually, we had a meeting, as Dr. Densmore mentioned, at Illinois a year ago, and now actually see a lot of ongoing efforts in other countries as well. So we will actually have another follow-up meeting, and I think one of the agreement is to share all the protocols and the softwares developed in the consortium.
Okay, thanks.
Okay, thanks.
One or two? Cool. It's a complex system here. So my name is Conny, and to the bento box talks, I actually started getting interested in biochemistry and genetics when I was 14, and there was no bento box, so I would have loved to have one. So I was fascinated by the genetic code, what it means, and how we can engineer genomes and organisms to produce what we want. And during my education, I really got confronted with this thought of the challenges we encounter in science are special. And there are 2 or 3 main reasons for that. The first one, cells are still a black box. That was very much true 10 years ago and still hasn't been quite fixed. But the other one is there are very few tools and technologies that are really catered towards scientists. We're kind of the special field out there because of our problems. But throughout my career, this hasn't really changed, but I've been able to, or I'm thinking of this problem in a more abstract way now. And specifically when you think about more the natural product space, for example, you can think about it as design your yeast cell. You have to then source the reagents to make it. Then you'll actually make it. You need to scale your process. And in the end, you need to sell it. Sounds fairly simple. And now there are multiple tools that you can use to tackle these challenges. So the first one is actually design and plan. But don't be fooled by the word design. Just because there's one stage called design, it doesn't mean your design only needs to trigger the initial or consider the initial stage. You actually need to consider how you're going to sell it or how you want to scale it when you're designing it. And that's a challenge we see, for example, in the antibody market now, and that's something that people need to consider. Another track is, of course, reproducibility. And when I started, I really thought that was only important when you make it, but in the end, it really also matters where you source things. Where do your reagents come from? And also, do you design your experiment to be reproducible? And lastly, across all of these things, you need to collaborate. There are mostly different scientists from different expert areas that are responsible for scaling it or sourcing it, and you need to communicate with all these people on different time frames. So then, after about 10 years being in the wet lab, I decided to focus more on software. And I joined the company called Autodesk about 1.5 years ago. Autodesk actually makes software for car manufacturers and the movie industries and building buildings. So how is this relevant? Well, about a month in, I met a car manufacturer, a guy who designed cars for the past 60 years. And he told me the story. About 50 years ago, the challenges we encounter in car manufacturing are special. They had exactly the same thought. So I thought, are there some similarities? And the exact same thing holds true in the car manufacturing industry, right? You need to design your car, source the parts, make it, scale it, sell it. It's the same thing, but 50 years ago. So how did they tackle it? 2 main things, CAD/CAM software and lights-out automation. We love the term lights-out automation, but I'm not going to talk about that. I'm going to focus more on the CAD/CAM software part. And that's actually where a business thriller ensued in the car manufacturing industry. So in 1964, the car companies like General Motors or Ford or even Nissan and Toyota all started to develop their own CAD tools. They spent millions of dollars hiring the right people to make new software to design cars. And now you see in color, there are 2 companies coming up. Those are actually independent software companies that are trying to do the same thing. Why? Because all these companies, these are a total like 9 different companies, had challenges because they had car manufacturers design software. They're not a software company. They had utilization efforts, they didn't know how to communicate across tools, or the agencies where they then sourced the parts from didn't have the same software because the General Motors software was only in General Motors. So that really started now the area of the companies going in, and you'll see at this point there are 5 companies, and the vast majority of them are not using any of the technologies that these companies have developed for a lot of money over a long time. And now in the end, actually, there are only 4 software companies available, Autodesk is one of them, that are selling software in the CAD/CAM area in the car manufacturing industry. Sounds like a happy ending? Not quite, because they didn't switch over, these car companies didn't switch over cold. They tried to make a slow transition, and none of these tools in the beginning were built with integration to think of. So the cost that is associated with that is called interoperability cost. So when I have 50 different systems, how do they communicate with each other? So in 1999 or so, they did a study. It's $1 billion per year per car manufacturing company just on interoperability cost. $1 billion. What does that actually mean? In OpEx, you can think about it like that, 4% OpEx. 4%, what's your OpEx? Do you want to leave 4% on the table just because you made wrong software decisions in the beginning? So that has happened for the car industry. And so we're building the same tools now in the life sciences industry, specifically for the areas of design and plan, for the design and plan stage and the collaboration stage. And the tool that we're building is called Genetic Constructor. It's a tool to easily design the genetic structure you want to build for the scientists. It can be extended by the IT people within your company so you can use existing structures, but it's also built with collaboration at its core. So I just want to show you a brief example. The task is to design a library of 8 promoters, 3 genes, and 4 terminators and 1 plasmid. Sounds easy. So what you usually would have to do is you have to find all your sources from your collaborators and your people in your lab, and then you start making the first design. So you copy-paste all the sequences together. Now you need to make the primers. Let's assume you use a Gibson-based assembly process. You do that all manually, you copy them all together, and now you repeat that 95 times because that library has a size of 96. That'll take you a couple of days because you need to make sure you have actually correct and you have more than 500 steps. With the software that we're developing, you can basically import these from a database within your company, assuming you have a database. And you can design the library in one go. So you just drag and drop your pieces together in one visual interface. And you just hit one button to actually design all those primers at once and export them to a CSV sheet. And then you can easily share that design with your collaborators. So that's way fewer steps and is way faster. How does this look like? So this is actually the library of 96 different variants together, and you see that these different, what we call list blocks, where all these variations are shown in one design. Over here is actually the primers button that generated all these assembly primers, so you can make your overlapping pieces and then put it in the reaction together. And the last thing we're working on, just my last point, is actually combining that with a protein visualization. So here the cellulase protein has been detected. We do this automatically. And now you'll be able to actually right-click on the amino acid to do a mutagenesis library for that particular residue, so you don't have to count anymore. I really hated that. And so we're actively working on that. And with that, I'll leave it to any questions.
So my question is for extensibility. How extensible is this, and what if, I shudder to say, someone doesn't do genetic engineering experiments, or molecular biology even?
Of course. I mean, so we're right now focused on one specific target segment, which is really in the natural products area where there's a lot of genetic engineering. Extensible, everything in the UI is extensible with a right click. So we really have an API interface where as long as you have a computational process that can run in the back end, you can add a button option to the front end. And there will be an SDK published at some point. Right now we're only doing this with partners, but the infrastructure is there that everybody could do it. You can think about it like the iPhone a little bit. Thank you.
So, hello everyone. Thank you for coming out today. It's an opportunity for us to talk a little bit about what we at Bioz are doing. So, what is Bioz? The best way to think of Bioz is if you think of TripAdvisor or Yelp. So whenever we look for something that we're looking to buy, we like to have some way of determining whether or not it'll actually do what we want it to do. And as difficult as it may seem to us coming from the tech world, in the area of life science tools, so anything which was used in experimentation, whether it's a reagent, so it could be an antibody, cell line, microscope, petri dish, consumables, scientists, when they go and conduct their experiment or build out their experiment, the ingredients, they really don't have any way to objectively find what will or will not work. And I'm sure a lot of you guys who have worked in wet labs, whether it's in R&D departments at biopharma or whether it's at an academic institution, with antibodies. Antibodies have been shown, and Nature has published profusely about this, how they fail 50% of the time. We've talked to a lot of executives at companies like Bio-Rad and Thermo Fisher, and they actually say they fail more like 90% of the time. So for us, coming from the area of life science research, and kind of, which one? Number one? Okay, got the wrong remote. So let's try this one. So for us coming from the area, and trying to put together this application, we said, how is it possible that we have no way of determining what will or will not work in experiments? It's kind of unheard of. When we go, it's like booking a flight to Hawaii and finding out that you're actually in Brazil. So life science researchers have a much more difficult product than we have, because they have to select from a very large number of products out there. And as crazy as it may seem, there are about 300 million different options to choose from when it comes to life science tools. Not only are there a lot of products, they come from about 50,000 different vendors. Bioz has already identified 50,000 vendors that produce tools for researchers to choose from. So again, a lot of them fail. It's very hard to choose. And when they fail, they're wasting time, because they only discover that they fail 6 months or so into the experiment, and that can be a big issue. So what we did is said, what do researchers do today to determine whether or not they should buy an antibody or other item for experimentation? They typically go to the life science publications, look at the material and method sections and supplementary data, and try to determine what worked for others. And it makes a lot of sense. If others bought something on Amazon, let's say we're looking for a headset, and we see 3,000 individuals who've bought the same product and given it a 4.5-star rating, we're very confident that that makes sense. If we see another product might have gotten 5 stars, but has only 3 individuals who've rated it, maybe we're less likely to buy it. So that's interesting, and we use Amazon these days and Yelp and other platforms, OpenTable, to book things. But the one big issue there is it's very biased. So research has shown that like 30% of Yelp and Amazon reviews are fabricated. There are companies out there which let you buy reviews. So we said, okay, let's do the same thing as Yelp or TripAdvisor, but let's do it so it's unbiased. So we said, let's look at the publications, do exactly what researchers do today, which they go to papers, and figure out what will work based on what worked for other researchers. So we came up with this platform. Think of it as a search engine, kind of a search engine enabling a marketplace. So a researcher would type in in this case, type in the reagent name. It would be anti-GFP or IL-2, and they would see vendors which produce the product and ratings for each item. So again, this is just a little bit about what we've already pulled out of the entirety of PubMed. We have 200 million products listed already on the platform from 50,000 vendors. We pull out also not only what worked for researchers, but how it was used. So think of like a restaurant. It's great to have the right ingredients, but wouldn't you also like to know what they did to use those ingredients? So what temperature, what time? So in our context, we're using the dilution that was selected, if it's concentration. We pull all of that out. So we indicate what worked for researchers and how it was used successfully to save the researchers time and money. Again, we have already 1 million users who have used the platform, and we're growing every day at a very high rate. We've decided to not only just show what worked for researchers based on what you're searching for, kind of like what Google does, but we decided to structure that information. And what we do is we have an algorithmic score that's primarily based on the number of mentions that researchers were using. And those mentions are added together algorithmically to create a rating for the products to help researchers see what worked for others and what might work well for them. And that's the Bioz stars rating. For products that have not yet been mentioned in articles, we have the V-star rating, which is the vendor aggregate rating based on what their other products have been used as. So again, we're in 195 countries, so I'll skip over this quickly, but the similar distribution to what you'd see from any other e-commerce platform for life science research. We're growing very, very fast. Google loves our data and is showing us in the search results for already 713,000 different products out of our 200 million. just a sample of the users. This was actually from the first day after launch, so just to give an example of the breadth of the user platform. Individuals involved, a lot of Nobel Prize winners, my dad amongst them as well, who got the prize in 2016 in computational biology. So former CTO of Microsoft's involved, CPO of Intel. So a lot of people who believe in our vision of being able to kind of give researchers the TripAdvisor or the Yelp that will help them in the research. And if I can leave you guys with one thing about this platform is that it's all about zero bias. So zero bias, show you only objective information from articles. We do not have any user reviews. We do not believe in having user reviews. If you want to add in user information, it needs to be verified and validated. And then the transparency. So we show all the information from within the articles, the excerpts of how we found that data. And it's very simple. If it worked for enough people, the sample size is large, enough people, and you know exactly that product, you should use it as well because it's most likely to work for you, which will save all that time wasted on validation in academic institutions and all the time wasted when it comes to biopharma companies running multiple parallel experiments to make sure that one works. And that's it. So thank you very much for listening. So happy to answer any questions anyone may have. So yes, please.
Isn't this going to be biased towards reagents that have been around for longer? Rather, how do you get new reagents into your system?
So it's a very good question. So we work with the vendors. So we're partnered already with Thermo Fisher Scientific, we're partnered with PerkinElmer, GE Healthcare Life Sciences, and all the different vendors out there who come onto the platform not only for lead generation, but also to kind of make sure that all their products are listed. Anything which is in an article gets a Bioz stars. If it hasn't yet been mentioned, it gets a Bioz V stars. Once it's mentioned, it transitions to a Bioz stars. So the algorithm we use includes many, many parameters, many of them normalized and weighted accordingly. So if there's a brand new product which hasn't had a chance to have any mentions, we know it's new. So recency is a very heavy parameter in our algorithm. Impact factor from journals is also there, but it's a very small one, of course, because we know how biased the impact factor can be in judging. But the algorithm, it's again, I'll give you an example. Google's search uses 20,000 different parameters in their algorithm to determine what comes up first. So there's a lot of weighting which can go into here to make sure that you're seeing an objective score for that product.
Yeah, I understand your sentiment why not include user reviews.
Yes.
But arguably a lot of sort of useful information can come directly from users. Like, do you see yourself in the future sort of working in parallel with the users?
Yeah, it's a very good question, and ultimately the objective is to make sure that researchers see the correct score. Is this, what is the likelihood it will work? So papers give us one piece of information, users can give us the other. The only thing that you have to be very careful is to not introduce bias into the score. So a very, very strict validation has to occur of the person who's giving us that kind of subjective data point and added in a careful fashion so that it doesn't taint the lack of bias in our score. Feel free to come over and we can show you a demo of the platform too. But thank you, everyone. Appreciate it.